cough, fever. What have they got going on here? It's a little bit trickier to spot this one. We've got our descending aorta visualised quite nicely, but we've lost the ability to spot the left hemidiaphragm in here. Can't tell where it is. And if we look behind the heart, through the heart, remember how we saw some vessels? We can see a few here, but we've lost the ability to see all the vessels in this area. Okay, so this is a left lower lobe consolidation. If we look on our lateral image, we've lost our more black sign. As those vertebral bodies come down, they suddenly become more dense at the bottom here. Actually, you can kind of see the fissure being outlined here, and we can only see one hemidiaphragm. Therefore, there must be something of the same density sitting next to that diaphragm obscuring it. So that is left lower lobe consolidation. So advanced tip, you want to be looking through the heart to spot that loss of vessels, to find that consolidation, looking through the diaphragm as well. Here's an example of looking through the heart and looking through the diaphragm. You might look at this chest x-ray and think it looks pretty good from a consolidation. The lungs look pretty well aerated. But if you look in through this right side of the heart here, it's a little bit too dense in here, can't spot any vessels through it. And if you look through the liver here, again, very, very dense. I can't see any of those lower lobe vessels coming through it. By the way, this patient's bones are a little too dense. They must have some underlying condition. But let's ignore that for this discussion. On the lateral image, what have we got here? Vertebral body's getting more lucent, but they're suddenly getting more dense at the bottom here, definitely. Much more dense. And what about hemidiaphragm-wise? Well, we've got two anteriorly, one here, but then we've only got one once we get further back, right? We're losing this one. So this tells us that we've got some consolidation in that right lower lobe through the liver. So the lateral chest x-ray was useful, and it's quite amazing just how much consolidation can hide there behind the heart and through the liver. Beautiful examples of air bronchograms here as well. You can see that correlation of why we would see those black branching structures on a chest x-ray.